Welcome everyone to Dr. Nguyen's YouTube channel. Today, we dive into the topic of the COVID-19 outbreak epidemic. Over the next few minutes, we will explore this global health crisis that has transformed our lives in ways we could never have imagined. We'll start by taking a bird's-eye view of the pandemic, tracing its origins and the causes behind its rapid spread. We will delve into the symptoms that signal the presence of the virus and discuss the methods used for diagnosing it. We will then move on to the medical and non-medical treatments that have been employed to fight the virus and manage its effects. We'll also shed light on the complications that can arise from the disease and the steps we can take to prevent its spread. As we navigate this complex landscape, we will address common problems and questions, offering answers and solutions. Prepare to arm yourself with knowledge and let's journey into understanding the COVID-19 outbreak epidemic. Firstly, we need to understand what COVID-19 is and how it originated. COVID-19, also known as SARS-CoV-2, is a novel coronavirus that was first identified in Wuhan, China, in late 2019. It's a viral disease that has since spread to nearly every corner of the globe, leading to a severe worldwide pandemic. Now let's delve into the basics of this virus. COVID-19 is caused by a virus that is part of the larger coronavirus family. These viruses are common in animals, and in rare cases, they can infect humans and spread. SARS-CoV-2 is believed to have originated in a seafood market in Wuhan, where live wildlife was also sold. The primary mode of transmission for COVID-19 is through close person-to-person contact. That is, when an infected person coughs, sneezes, or talks, they release respiratory droplets into the air. These droplets can then be inhaled by people nearby, leading to infection. Moreover, touching a surface or object that has the virus on it, then touching your own mouth, nose, or eyes, can also lead to infection. Risk factors for severe illness include being over the age of 65, having underlying health conditions such as heart disease, diabetes, or lung disease, and having a weakened immune system. However, it's crucial to remember that anyone, regardless of age or health status, can contract and spread the virus. Knowing the causes of COVID-19 is the first step to preventing its spread. Now that we know what COVID-19 is, how can we identify it? What are the symptoms and how is it diagnosed? Let's start with the symptoms. The most common ones include fever, dry cough, and tiredness. Some people might also experience aches and pains, sore throat, or loss of taste or smell. In more severe cases, individuals may face difficulty breathing or shortness of breath. It's important to remember that some people may carry the virus and spread it to others, even if they don't show any symptoms at all. So, how do we diagnose COVID-19? The most common method is through a PCR test. This test involves taking a sample from the nose or throat using a swab. The sample is then sent to a laboratory where it is analyzed for genetic material from the COVID-19 virus. There are also rapid tests available that can provide results in minutes, but these are generally less accurate than PCR tests. Another important diagnostic tool is imaging, like chest X-rays or CT scans, which can help doctors see the impact of the virus on the lungs, especially in severe cases. It's worth noting that while these tests can confirm if a person has COVID-19, they can't tell if someone had the virus and has recovered. For that, an antibody test may be used. Early detection is crucial in battling this virus. Stay vigilant and monitor your health closely. So you've tested positive for COVID-19, what happens next? Well, treatment for COVID-19 depends on the severity of the case. If symptoms are mild, home care may be sufficient. This includes rest, hydration, and over-the-counter medications to manage symptoms like fever and cough. For more severe cases, hospitalization may be required. Here, medical professionals monitor the patient's oxygen levels and other vital signs. They may administer treatments like antiviral medications, steroids, and in some instances, supplemental oxygen or mechanical ventilation. But what about non-medical treatments? Good nutrition is paramount in helping your body fight off the virus. Consuming a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can help strengthen your immune system. Hydration is also crucial, so make sure to drink plenty of fluids. Mental health is another aspect that shouldn't be overlooked. The isolation and stress of a COVID-19 diagnosis can take a toll on your mental well-being. Therefore, it's important to stay connected with loved ones, engage in activities you enjoy, and seek professional help if needed. Lastly, keep in mind that while these treatments can help manage the disease, they are not cure-alls. We're still learning about this virus, and research is ongoing to discover more effective treatments and therapies. Remember, Every case is unique. Always consult with your healthcare provider for personalized advice. Because when it comes to your health, there's no one-size-fits-all solution. While many recover from COVID-19, some may experience complications. Let's discuss these and how we can prevent the spread of this virus. In severe COVID-19 cases, complications can indeed be life-threatening. These can include acute respiratory distress syndrome, a serious lung condition causing shortness of breath, blood clots, which can lead to strokes or heart attacks, and multi-organ system failure, which can result in lasting damage to the heart, liver, or kidneys. Long COVID is another concern, where symptoms persist for weeks or even months after the initial recovery. Now let's shift gears and talk about prevention. Vaccination is our first line of defense. Vaccines train our immune system to recognize and fight the virus, reducing the risk of severe disease. But remember, no vaccine provides 100% protection. That's why it's vital to combine vaccination with other preventive measures. Wearing a mask is one of them. Masks act as a simple barrier to help prevent respiratory droplets from traveling into the air and onto other people. Social distancing, or staying at least 6 feet away from others, helps to minimize close contact with individuals who may be carrying the virus. And let's not forget hand hygiene. Regularly washing your hands with soap and water for at least 20 seconds can kill the virus if it's on your hands. Prevention is always better than cure, especially when it comes to COVID-19. So let's continue to do our part to keep ourselves and our community safe. COVID-19 has left us with many questions. Let's tackle some common problems and their solutions. One question that often arises is, how long does it take for symptoms to appear? Usually it's between 2 to 14 days after exposure. This period is known as the incubation period. However, it's important to remember that some people may not show symptoms at all, yet they can still spread the virus. A common concern revolves around the efficacy of masks. The answer is yes, masks do work. They provide a barrier that prevents respiratory droplets from traveling into the air and onto other people. But remember, they're not a substitute for social distancing and hand hygiene. Another frequently asked question is, can I get COVID-19 more than once? While we're still learning about this, reinfection appears to be rare, but possible. It's another reason why we should continue to take precautions, even if we've recovered from the virus. Many wonder if it's safe to get vaccinated if they've already had COVID-19. The answer is a resounding yes. Vaccination is a safe and effective way to build protection against the virus. A prevalent problem is misinformation. It's crucial to rely on trusted sources for information, such as the World Health Organization or your local health department. Be wary of rumors and unverified information on social media. And finally, where can I seek help if I or a loved one is feeling overwhelmed or anxious about the pandemic? It's perfectly normal to feel this way. Reach out to mental health professionals or trusted individuals in your life. Many helplines are available offering support and guidance. In solving these problems, we must remember to maintain physical distancing, wear masks, wash our hands regularly, and get vaccinated. These are our best defenses against the virus. Remember, staying informed is one of the best ways to stay safe. Let's continue to learn and adapt in these challenging times.